back to Our Kids Today. My name is Becky Bennett. I'm the Director of Development with Pasco Kids First. And today I'm joined by Sandra Marerro, who is the manager for Baycare Behavioral Health Services. Welcome, Sandra.
Thank you for having me.
Sure. Baycare is a tremendous organization in the Tampa Bay area that has clinics and hospitals and lots of other services all focused on the healthcare of our community. So tell us a little bit about behavioral health services.
Sure. Well, behavioral health services are mental health and substance abuse services, and we have a very large branch within the Baycare health system, which, like you said, is one of the largest healthcare systems in Central Florida. And so the behavioral health branch has multiple sites between Pasco, Hernando, Pinellas, Hillsborough County, offering services for mental health and substance abuse.
Great. And you provide services for all ages?
We do. We have services for all ages, and what's really neat about the behavioral health branch is that we have a comprehensive continuum of care. So we have services that start out from prevention all the way through outpatient treatment, through all the way through crisis, hospitalization, and residential programs. So we kind of have a little bit to service everyone depending on where they're at.
Fantastic. And you manage the Hernando division.
Correct.
Where's those offices located?
Sure. The Hernando branch is in the Midway Plaza, which is on Cortez Boulevard, 15311 Cortez Boulevard. Here in Hernando.
Okay. And if somebody wanted to access services, how do they go about doing that?
Sure. The main number that we give people to contact us is our registration center. So that's 1-866-762-1743. When you pass by Cortez Boulevard, the number's flashing on a large LED sign that we have outside, but that's the number that we give out for folks to contact us. We have an open access, so on Mondays and Thursdays, folks who want to receive some services can come to our site, and between 8 and 4, they will receive a full biopsychosocial assessment, and they will meet with a clinician that will talk with them and get them plugged into the services that they need.
Great.
Now, the open access does not include medical services, so the psychiatric services are scheduled differently. But for folks who want to come in and get some of the clinical services, including outpatient therapy, group therapy, and we could talk a little bit more about those services, they come in Mondays and Thursdays.
Okay, great. Well, I know that with working with children, Pasco Kids First, we have a trauma treatment team that provides trauma therapy for children, and it's really important to include the family and the parents to also focus on the impact that they're making.
Sure.
How does Baycare view that with including the family with the children's services?
So if the services that are recommended or requested are outpatient services, we offer family counseling, so we include the family there. We have a service that's called TBOS, which stands for Therapeutic Behavioral On-Site Service. So if the service is outpatient therapy, we provide family therapy, group therapy. If some of our in-home services, like TBOS, which stands for Therapeutic Behavioral On-Site Services, it's an in-home, it's a little bit more intensive treatment. They use a family system approach to therapy, so they include the entire family. They realize that although it may be a service for the adolescent, the entire family is impacted by the behavior. The entire family is going to help heal and keep this person well. So we operate under a system of care. It's a whole system, so we include the entire family.
Wonderful.
Yeah.
Wonderful.
We also offer case management services, and we try to include the family to find out what are some of the barriers for them to be self-sufficient or for them to be well and stay well in the community. And so that is a service that's offered in the homes, in the schools, and to the entire family.
Fantastic. And how can the community support Baycare? What can they do to help address the problem of mental health and substance abuse?
That's a great question. Unfortunately, in the world that we live in today, we all need to help each other out because we have, terrible things happening in this world. So my recommendation is always that the community can take a class. It's called Adult Mental Health First Aid or Youth Mental Health First Aid. And so I happen to be an instructor of that class. It's a service that we also offer. And what it does is to help prepare people, just common citizens, for what to do in case they are present in a mental health crisis or substance abuse crisis. How do they respond until professional help can get there? And they're taught those skills. It's a full 8-hour class, but it's usually free in the community, or depending on where you live, there may be a cost to it. But anybody can take that class, and it's going to give you tools to potentially save someone's life.
That's awesome. I think I just heard the United Way was participating in a class.
Yep. I recently spoke with the executive director of the United Way, and she was really excited that her whole staff was taking it. They came to the realization that they were interviewing people who came in for help that they wish they knew what to do because they were exhibiting some mental health crisis, and they saw the benefit of taking that for their staff. So I was really glad that they all signed up. And I think it's a great course, not just because I teach it, but it's excellent information. You can go on their website, the mental health first aid website, and get information. It's a global course. It's taught all over the world, and it's a standard course, so it's taught the same everywhere. And it's kind of like CPR, but for mental health. It's what do I do in case I, am in a situation where somebody needs my help.
Well, that's fantastic, because there's the mental health and substance abuse. Every person knows somebody in their family, their neighbor, and how to address it and to be sensitive about those topics are so important.
Sure. The statistics are that 1 in 5 have some sort of mental health issue. Probably is greater than that, maybe underreported. What's really neat about the mental health first aid course is that it helps the community by reducing the stigma and increasing everyone's mental health literacy. And so that's important, because the more we know about mental health and substance abuse issues, and the more we watch our language, we can create a culture for people to get the help early on. We want people to get help before they're in a crisis. We want people to know what some of the risk factors are and warning signs are, so they can get some help and get to a professional in a timely manner. We know that early intervention is really key. We want to prevent those hospitalizations where people are perhaps involuntarily hospitalized. We want to try and get them upstream.
Fantastic. So are there any other programs that you want to talk about?
Sure. Well, there's a lot of different programs that the behavioral health offers. So I talked a little bit about case management, and case management works with the families on trying to link that family to the resources that they need and remove any barriers to treatment, so that that individual, whether it's a child or an adult, because we do both children and adult services, can get the help that they need. We offer traditional outpatient services, so that includes family therapy, group therapy, individual therapy, again for mental health or substance abuse issues, and both adults and adolescents. We have higher, more intense treatment programs. We work very closely with the child welfare. We have actually an entire area that works and services the child welfare population. So we have a person that's co-located at DCF to try to help families when they are potentially involved in an investigation, to try to catch people early on, again, so that we can get them linked into services and linked into getting some help as quickly as possible. We have some higher, more intense programs for folks that may have tried a lower level of care but really haven't been able to be successful at that level. So we have family intensive treatment teams. We have CAT teams, which have wraparound services. So those teams usually offer a therapist, a case manager, a peer mentor, someone that has been there, has lived experience that can help that individual going through whatever they're going through, whether it's an adolescent or an adult, and a psychiatrist. So they have an entire team wrapped around them to provide full wraparound services to help support them through whatever it is that they're going through, so they can be well and stay well. But like I said, in this community, in every community, we just kind of need to help each other out, because the demand is much greater than the supply. So if we can all help each other out, that would be great.
Great. So tell everyone how they can find out more about Baycare. How can they contact you? Well,
sure. And just going back a little bit, I wanted to talk about the fact that Baycare also partners in the community. We have to partner just because we can't do it all ourselves. So currently, at least in Hernando County, there are a few school-based services where we have a clinician that is actually like a licensed therapist at the school offering services to adolescents. And we actually have one in middle school, one in elementary school, and this year the school board decided that they were going to start a new program, and we also staffed the clinical team for that, or part of the clinical team at a high school level. So there's 3 high schools that offer an elective class that we have a master's level clinician at, helping them identify coping skills so that they can mitigate any symptoms that might be coming up for them.
Wow.
And learning how to help other people too. There's a lot of work that we do in the community with our partners that we feel is really important.
Yes, we do see you all over. I know Pasco Kids First has an event coming up. It's our 11th annual Family Fun Day, and we're really grateful for Baycare. It's presented by Morton Plant North Bay Hospital and St. Joseph's Children's Hospital. Great community event at Sims Park, November 3rd. We have a health walk around Orange Lake where the kids can win a bicycle. There's a shoot the fire hose. We have a touch a truck activity with ambulances and school buses. It's going to be a great event, and that's at Sims Park at from 10 to 3 on November 3rd in Newport Richey. So we thank Baycare and the hospitals for participating in that.
We're glad to do that.
So tell us, how can people get a hold of you?
Sure. Well, people can get a hold of me directly by just emailing me. My email is sandra.marerro@baycare.org. If you want to learn more about Baycare, you can go to our Baycare website, baycare.org/behavioral health. If you want to just focus on the behavioral health, you can contact their main number if you're interested in receiving services. So that's 1-866-762-1743. And we'd love to help you. We're also pretty much, like you said, we're in the community, so we like to look forward to community events, and we want to get information out to the community about our services. So we have a mental health summit that's coming up in October. That's being put on, I believe, by NAMI. So I would say if people want to learn more about mental health, they could also go to that summit.
Fantastic. Well, thank you so much for being here.
Sure, my pleasure. Thank you for asking us.
Yes, we appreciate it. And to learn more about Pasco Kids First, visit pascokidsfirst.org.